Hello there, my lovely. Make yourself comfortable. My name's Dr. Sarah. Could you just confirm your name for me? Okay, that's perfect. Just going to check the notes I have here from when you called in earlier. Okay, so I believe you've been experiencing some ear pressure and pain, some discomfort around the ears. Yeah? Okay. Alright, and how long has this been going on for? Okay, about a week, okay. Okay. Do you have a history of problems with your ears? Okay. Wax build-up, okay. Okay, do you have any other symptoms? Nasal congestion, fevers, sore throat? Just a bit of headache. Okay, a little bit dizzy. Alright, okay. Okay. Right. So has this been affecting your ability to work or function? A couple of days, the recent days, yeah. Okay. Well, given that you've got a history of problems with your ears and wax build-up, obviously I need to check you out, and if there's anything there that I can remove, I'll remove it for you today. Alright? Okay, do you have a latex allergy at all? No. Okay, that's fine. Right. Let's get some gloves. These are latex gloves, that's why I asked you about the allergy. We do have alternatives. Right, that's those on. First thing I'll do is just check your lymph nodes around your neck, my lovely. Just keep nice and still for me. Just going to have a little press around. Okay, just behind your head. Okay, anything tender there? Okay, I can't feel anything unusual, so that's good. Okay, I'll just feel across your collarbone area. Okay, that's fine. Right, I'll gently wipe around the ears before I take a close look at them. Okay. Right. Got some lovely wipes here, nice and cool and refreshing. Alright. Keep nice and still for me. I'll just have a gentle wipe on your left ear. You like that? Good. Another wipe. Okay. Let's take a look at your right ear now. Okay, so I'm going to have a press around on the outer ear. Okay, tell me if anything's uncomfortable at any point. Alright? Okay, I'll just be sort of feeling around and having little pinchy movements and just gently tugging on the ear, okay? That can just indicate how much pain you're getting or if it's a sign of infection, okay? But also be looking very closely for any signs of unusual skin details, lumps, bumps, anything like that, alright? Here we go with your left ear now, my lovely. Okay. I couldn't feel anything unusual there. How did that feel? Just a little bit sore. Okay. Okay, how was that? Okay, a tiny bit uncomfortable again. Okay, right, I'll just make a little note of that. Alright. Okay. I'll just quickly take your temperature before I look down your ear, okay? I'm just going to pop in the thermometer. Just hear some beeps, okay? You'll be pleased to know that your temperature is perfectly normal, so that's good news. Okay, it's at 36.9, so that's really good. Okay, so what I'm going to do now, my lovely, is I'm going to use this otoscope here and just going to pop it down each ear and have a little look at what's going on, alright? I need you to keep very, very still for me, but please pop up your hand if anything is too uncomfortable for you, alright? Okay, just turn that on. Right, there we go. And it's got a little light on it, and you can see the light. It helps me see right down your ear. Okay, perfect. So, I'll be very gentle, don't worry. So here we go, going in now. There we go. Just moving right around. You have got a lot of impacted wax down here, so I am going to remove that. little bit of redness in the ear canal, but I can't see beyond that right now, so I'll just remove that. Okay. How was that? Alright, okay. And again on this side, just pulling up and back and popping that in there now, my love. Okay, lots of wax yet again, and some slight redness. Can't see much else, so I'm going to need to remove that wax. Just pull that out now. Well done. Okay, just going to make a note. So we've got wax, action, both ears, slight erythema in both auditory canals. Okay. Right. So what I'm going to do is put some really lovely drops down your ears. They're my patients' favourite drops. They all love them. And they fizz and crackle a little bit, but they work through the wax and break it down, so it's a lot softer and easy to remove. Okay? Right. Have you had these kind of drops before? Yes, they're very similar to the ones that you could get at the pharmacy, but these are a little bit stronger. Okay. Give them a nice shake. Just make sure they're nicely mixed. You'll just need a couple of drops in each ear, but they won't sting or burn. Right. I often get asked that, is this going to hurt? But no, these won't. Okay, I'll start with your right ear. So here's one and two. You can hear the sound? Good. That means it's breaking through all of that wax for me. Here's one. And two. There. Should be crackling on both sides now. Good. Perfect. Right, let me just make a note of what I've administered there. Okay. How are you doing? Good, good. Okay, so what I'm going to use is a little extraction tool. I'm just finding one that I think will be better suited to what I'm seeing down there. Okay. So I'm going to use this little spoon-shaped tool to just scoop out the wax that I can. I've also got two types of brushes here. I've got a soft brush and more of a metallic type of brush, and they both work in slightly different ways just to remove any excess wax after I've had a little go with the scoop. Is that alright? Again, if anything's uncomfortable, please just pop up your hand, but do keep still because I don't want to injure your ear in any way. Alright? Okay, so we'll start with your left ear, and I'll just have a little scrape around, make sure I've got something to put the wax on there. That's perfect. Okay. Right, here we go. Nice and still for me. Just going to go in with the softer brush at first. Okay. Right. Here we go. Going in with a different type of brush. Okay, this might feel and sound a little bit different. Okay, lovely. going to take a little look down there now. Okay, just with the otoscope again, very quickly. Okay, just popping that in now. Okay. That is looking so much better. And your eardrum looks fine, but you had a very, very nasty impaction down there, but we've successfully removed it, which is perfect. I'm happy with that. Just remove that. Okay. So I'm just going to move over to your right ear now and do the same. Are you okay? You're not dizzy or anything? Perfect. Remember, pop up your hand if you're uncomfortable. Okay. Right. Just put my things down there. Right, so I'm going to start with the scraping again now, okay? There we go. Seems to have removed a lot there. So I'm just going to go in with the soft brush just for that. With that different brush, just to finish this job off properly. I like to do a thorough job, of course. otoscope now. Nearly done, my lovely. You've done fantastically well. Okay, here we go. Just popping this in. Okay, that's much cleaner now. I think the little bit of redness in the ear canal will soon calm down now that wax has gone. There's no infection. And the eardrum looks perfectly healthy, as do the structures behind. Both ears are perfectly fine. And we'll need to just keep an eye on your wax build-ups though. Okay, I'll withdraw that now. There we go. Alright. How are you feeling? Good, good. Let me just make a little note of what I've done there. Alright, just have a little relax. I'm going to put you some very nice cooling drops down your ears in a moment. Okay, do you pay for your prescriptions? Okay, so just pop to the pharmacy and get some olive oil eardrops, alright? Use those daily, they will help soften any wax that's in there, alright? You don't need to start using them just yet. Leave it a little while, leave it a couple of weeks, and then just use a little bit of that, okay? I'll ask you to come back in about 4 weeks' time and we'll check your ears again to make sure that they're not getting blocked up too quickly or that the olive oil is working well. Alright, you do seem to produce a lot of wax naturally, which some people do, but obviously if it impacts regularly you run the risk of getting more pain and infection in the end, okay? So just ask at the pharmacy. They'll know what you need if you just say olive oil eardrops. Okay. Right then, so talking of eardrops, got some nice soothing ones as promised. Okay. Just put a couple in each ear before you go. You're not dizzy or anything? Perfect. Okay. Right. So here's one and two. There we go. They're lovely, aren't they? And here's one. And two. Perfect. Okay then, my lovely. If you're feeling well and happy, then you're free to go. Okay, don't forget to get your olive oil eardrops and make an appointment for 4 weeks' time with the receptionist, and we'll just keep a check on you because I think we just need to do that. Alright, okay. Well, enjoy the rest of your day now. Okay, take care. Bye-bye. Hello there, my lovely. My name's Sarah, and I'm an advanced paramedic practitioner. I believe you're not feeling too well. Yeah? Okay. Alright, well, I've been sent from your GP surgery to take a look at you, alright? Just to explain, I'm not a doctor, but I am qualified to identify and treat a whole range of conditions and also prescribe medications as well. Okay. Right, so let me just see what's been going on with you then, my lovely. Okay, you'll see me typing things into my iPad. Okay, this connects directly with your notes and updates your surgery and the hospital. Okay, all right then. So you've been feeling very dizzy. Okay, a little bit nauseous. All right. How long has this been going on for? All right, okay. Have you had an infection, a cold or anything like that? All right, okay. Do you still feel like you have that infection now? Okay, all right, my lovely. Let's take a look at you. Does the dizziness get worse when you change position? Okay. And can you lie down? You go very dizzy when you lie down. Okay. All right. Okay. So I'm going to take a little look at you, all right, to see if we can work out what's going on and make you feel better today. All right. Okay. So firstly, I'm just going to have a little feel around the lymph nodes in your neck. All right. Okay. So you've had flu-like symptoms for about 10 days. Okay. But your headache's got worse. All right. You had a lot of nasal discharge. Okay. All right. Just you relax there. I'll take good care of you. It's normal to be anxious when you're not feeling well and it's a new symptom. Okay, I'm just feeling along the supraclavicular lymph nodes there and here too. Okay. Alright. A little bit swollen in the lymph nodes in your neck. Alright, so that would usually indicate an infection of some kind. Okay. I'm just going to pop this on your finger, my lovely. It's just a pulse oximeter. Okay, it just tells me the oxygen saturation in your blood and also your pulse rate. Okay, let's just pop that on there. Only needs to be on for a second too. Okay. Okay, perfect. So your oxygen sats are fine. They're at 98%, which is fine, and your pulse is at 88. Maybe a little bit faster than normal, but it's probably the situation that's making you feel a little bit more anxious. Okay, right. Are you on any medications at the moment? I can't see that you are. All right, that's good. Have you been taking any medications for your infection? Just paracetamol, okay, right. Which leads me on nicely to the next part of the exam. I'm going to check your temperature, my lovely, all right? Just going to pop this thermometer into your ear. Okay. Any side? This one? Okay, I'll come around here and do that. Right, you just hear a couple of beeps, all right, my lovely? Just relax there. Popping it in your ear now. You do have a little bit of a fever still, 38. So I'm guessing you've got a secondary infection of some kind from your virus. Alright. So with the dizziness, are you noticing any pain in your eyes at all? Okay. I'm going to shine a light in your eyes now, my lovely. It will be bright, but for a very short period of time. I'd just like you to just look straight ahead for me. Okay. That's it. Don't move your eyes. I'm just going to be shining a light in and out briefly. Okay? Perfect. Okay, lovely. Alright, that's fine. Now, would you just follow the light briefly for me? Okay, so keep your head nice and still and just follow the light with your eyes. Okay, right, just up and down. Okay, across and up and down. Alright, all good there. Okay. Need to check your blood pressure. It's one of the key things we have to check when anybody has dizziness, just in case it's related to some kind of pressure change. Just need to pop my stethoscope on for this. Okay. I will give it a little warm up for you. They can be quite a shock when they're cold. Okay, so I'm sure you've had this done before, but I just need to pop the cuff on your arm and inflate it. It'll go tight, it shouldn't be painful, but you will feel some pressure. There we go, just relax your arm. Perfect. Right. Let's get the stethoscope and pop that under there. It's lovely. I'm just going to inflate the cuff now, okay? Right. Just check that again there. No, it's fine. I just like to double check it when I'm doing it. It's always good to double check. Yeah, that's fine. That's fine. Take that off you now. Okay. Not going to check the other side today if you are feeling particularly dizzy, because it can make you feel a little bit more dizzy, so I won't do that. Right. Just want you to breathe normally for me. I'm just going to place the stethoscope onto your neck. Alright, okay. Okay, now I just want you to take some deeper breaths for me. So I'll pop that there and go in and out. Okay, and again. In and out. And again. And again. Again. Perfect. One more time there. Okay, just round the back a little. In and out. Okay, around this side. In and out. Okay. Can you say 99 for me? Okay, and again. Lovely. And could you give me a little cough? Okay. I am hearing a little bit of a wheeze on your chest. It sounds like there is a little bit of infection there. You've been coughing up some mucus. Okay. All right, my lovely. Just place those down there a second. Okay. All right. I'm just going to pop my hands under your ribs. Could you just take a deep breath in for me? Okay. okay? Just a little higher up now, and in and out. Okay. I'm just going to be tapping around your ribs and your abdominal area. Alright, tell me if anything feels uncomfortable, won't you? Okay, I'm just going to take a little moment to press around, alright? Okay, a little deeper this time. Okay, everything feels fine now, that's not hurting. Good, okay. Alright. Just going to have a little press around your face. Tell me if anything feels tender, alright? Okay. It hurts there, okay? And what about up the top here? Okay. Alright. Yeah, definitely feel that that's a sinus issue. Okay. I'm going to take a look down your ears, okay, to see if there's any infection going on down there, anything unusual. Is that alright? Okay. So I'll be using this otoscope. It has a light on it. This is going to just be inserted into the ear canal. Alright? Keep nice and still for me while I do it, won't you? Okay. Okay then, my lovely, so I need to just gently pull up and back on your ear and just insert the otoscope. Okay, keep nice and still for me. Pop up your hand if it feels really uncomfortable. Okay. Here we go. Insert that now. There we go. Well done. Just having a look down your ear canal. There's some redness down there, and it looks like there's some fluid behind the eardrum. I can see the bubbles. Looks a little bit cloudy in there, so that would indicate that there's some otitis media, which is a middle ear infection, and a little bit of otitis externa, which is in the ear canal. Right, okay. Just reposition a second. Okay. Right, I'll remove that now. Okay. Very well done. You're right there. If you feel really dizzy, just tell me, okay? Alright. So, same again, just pulling up and back, my lovely, and inserting this now. Alright. Little redness in the ear canal. This ear drum looks a little bit fluidy behind, but not as bad as your other ear, but I still think there's some infection going on. Okay, let me withdraw that now. Okay, there we go. Right, so let me take a little look at my nose now. I'll just gently push on the tip of your nose and insert the otoscope. Might feel a little bit uncomfortable, but only for a short period of time. Right. just push up there and just insert that now. Okay. Yeah, I can see some blood up there and some purulent discharge, mucus, so it looks like there's a sinus infection. Okay. And this side now, my lovely, okay. Just insert that now. Yeah, same up there. Okay, just relax there now. Alright, let me just take a little look down your throat. Okay. You know what's coming now, don't you? The lovely tongue depressor. Okay, sweetie, just open nice and wide. I'll do this as quickly as I can. Alright, okay, nice and wide. Perfect. Say R for me. Okay, and say R again. Okay, a little bit sore looking down there. Has your throat been very sore? Okay, alright. Okay. So could you just make some eye movements for me? Could you just look quickly to your left? Okay. And to your right? Okay. Could you quickly look up? Okay. And down. Okay. Does that make you feel more dizzy? Okay. Could you just tilt your head very slightly to the left? Okay. Very slightly to the right. Okay. Could you just pop your head up a little bit? Okay. Has that made you feel worse? Okay. Just relax there. Okay. So would you like me to give you something for that dizziness now? I can do that. Yeah? I can give you a tablet that dissolves in your mouth or an injection which works faster. You don't mind the injection? Okay, perfect. Alright, I'll put these over here. Right, I just need to get that together. I brought some medicine with me. Okay, because I thought if you needed something, at least I could give you something while I'm here for the dizziness. It also helps with the nausea, which is being caused by the dizziness as well. Brain's just getting a little bit confused in the same way it does with motion sickness, and it can trigger the nausea, which we don't want, do we? No. Okay, so I'm just going to get an alcohol pad before I do this. Okay, so have you got any preference to which arm? Okay. Just need to open the pad. Okay. We'll do it in this side, shall we? Okay then. So let me just give this a good wipe. Okay, perfect. Right, you're going to feel a sharp scratch now. Okay, I'm just going to pop a little bit of this medicine in there. Alright? Okay. Just move around to do that. Okay. Alright, here we go. Sharp scratch now, my lovely. There we go. Well done. All done. Perfect. Okay. Right. That should work in a few minutes, yeah. Okay. I can give you the tablet form of the prochlorperazine, and it will dissolve just inside your lip. You can do it just up there, okay? So you don't have to worry about swallowing tablets if you're feeling nauseous. Okay. Right, just updating those notes as I go there. Okay. So have you had any pains in your limbs at all? Just a few aches? All right. Yeah. Okay, that's understandable. I'll just have a little feel down your arms. You can tell me if anything does feel sore, and I'll check for any rashes while I'm here. Okay? Perfect. Just relax. You may feel a little bit sleepy after that medication once it starts to take effect, but that's okay. But if lying down makes you feel terrible, then just try and sleep as much as you can sitting up. Okay, I can't see any rashes, which is good. Skin looks healthy. Perfect temperature. There on the arms, yeah, that's okay. A little bit warm across your chest from the fever, but hopefully with the paracetamol that'll be under control, but you don't feel overly clammy or anything like that, so that's good. Okay, let's take a little look at this side. Nothing feels sore, no. Okay. Again, no signs of any blotchy rashes, patches, anything like that. Skin looks healthy. Okay, just going to take a look at the fingers. Alright, they look perfectly fine. Looks like there's good blood flow down there. That's fine. Just take a look here. Okay. Right. What I think we've got going on here is a secondary infection from a virus, like an influenza virus. Okay. Seems to be really concentrated around the sinuses and the ears, which would explain your dizziness. Alright. If there's fluid in the middle ear and the infection can get in the inner ear, it can really knock you off balance, and we need to get that treated. Alright. You've also got some irritation in the ear canal, and I can put a couple of drops in for that now, okay? But I'm going to prescribe you some antibiotics as well to get on top of that infection. Okay, so I'll issue a prescription. You're not allergic to any penicillin, are you? Okay, well I'm going to prescribe 500 milligrams of amoxicillin. Okay, we'll try 3 times a day. That should attack the bacterial infection in the sinuses and ears. Any problems with it, obviously just call the surgery, or if you're not getting better after about 4 days or so, again call back, alright? Okay, that's gone straight over to the pharmacy. Could somebody collect that for you? Oh, okay. I'll tell you what, I'll be coming back this way later, so I'll pick that up for you and drop that off. Is that okay? Oh, that's fine. It's not a problem. I need to come this way. So I can do that. I'll put my little note on there. Alright, my lovely, so that's all sorted. I think actually I'll prescribe you some drops as well for your ears. So I'll get you some. Actually, let me just check. It's better in a spray form, actually. It's much easier to administer, so I'll give you some spray. And that will help calm down the ear canal problems. So I'll get them over and I'll bring those round later. Alright. So let's see what I've got over here. Right, I'm going to pop you some drops down just to calm the sore ears. Alright, this isn't going to do anything for the fluid behind your ear, but it'll help soothe the ear canal. Okay, my lovely? It won't make you any more dizzy. You're starting to feel a bit tired? Okay, well I'll be done soon, so you can relax and just get some sleep. Make sure you're drinking plenty, even if you don't really feel like eating much right now. Okay, right. Keep nice and still for me. Right, here's one. And two. Lovely. Okay, good. Let's do this side now. Here's one and two. Okay. Right then. Okay, good. Right, that's me all done. I just need to tidy my things up and I will pick up your prescriptions. Okay, all these notes have gone straight back to the GP surgery. Like I said, that's where I'm based, but they'll also be held on your records. So if you ever needed to go to hospital, it will all be on there as well, but hopefully you won't need to go there. Okay, lovely. Right, let me tidy up my things and then I'll be on my way, and I'll pop back a little bit later. It's probably going to be about another 90 minutes, alright? Okay, but try and get a little bit of rest. Okay, lovely. Well, you'll be feeling better very soon, I'm sure. Okay, but have a little sleep now you've had that medicine. Yeah. Okay then, my lovely. Well, I'll be seeing you a little later. Alright, sleep well. Bye-bye. How are you doing? So, let me just take a little look at your notes here. Okay. So you know why you're here. Okay. Yes, we've had to put you in isolation because you've experienced some very strange symptoms and the hospital do not understand what's going on. So you're here at the facility so we can try and find out what's going on, okay? My name's Dr. Sarah. I'm going to be doing a few little checks on you today, okay? I'm sorry you've had a lot of this going on, but this is very serious. So, okay, you're claiming you've been abducted by aliens, is that correct? Okay, so you fancy yourself as a little bit of a Travis Walton or a Roy Neary? Oh, you don't know who they are, okay, right. Travis Walton, the film Fire in the Sky, abductee? No. Roy Neary, Close Encounters of the Third Kind, abductee? Do, you know, the 5 tones? No, okay. We'll leave that one there then. Alright, so this alleged abduction took place when? Right. Do you remember anything particular? Okay, so you have missing time. That figures with abduction, I guess. Right. I'm not going to waste any time here. I'm going to get started, okay? I have to be dressed like this to protect myself, okay? I'm not sure how many people are going to believe you with this one, alright, but seeing as you are exhibiting some very strange symptoms, I got the short straw, I guess, of checking you out, but don't worry, you're in safe hands. Forgive me for sounding a little bit sceptical, okay? Right, let me take a little look at you. You look sunburned. Is that so? Okay. Let me look at your arms. Okay, my lovely, let's have a look. Right. How are your eyes feeling? Okay. I'm going to shine a light in them. Alright, my lovely. I just need to check a few things. Just look straight at my nose there for me, and I'm just going to bring a light in. Okay? That's hurting you. Okay, I'll be very quick with this. Okay. Just going to have a look around your skin with my light. Could you just open your mouth for me? Oh. Your tongue is bright green. Oh. That's strange. Okay. Let me just take a sample from your tongue. I need to do this. Okay. So I'm going to just gently, with this swab, gently just scrape, okay, on the tongue. Alright. Stick your tongue out for me if you can, my lovely. Okay. Yeah. Well, in all my medical days, I've never seen anything that looks like this. That's going in the pot. Okay. Just going to make a note of this. Just relax there as much as you can. Gently pressing on your body, is that sore? No. Okay. Oh. I'm going to have a little look down your ears. I'm not sure what I'm going to find down here, but let's see. Right, I'll start with your left ear, my lovely. Alright, keep very, very still for me. Okay. fluorescent orange discharge coming out of your ears. And there's something happened down there, but I can't see what. You think it's an implant? It could be. It could be an implant, of course. If you're sticking with that story. Gosh, that doesn't look good. Okay. I need to remove that now. Okay. Alright, I believe you. Okay, let me just check this side. I'm just going to pop this in now. Okay. Oh. You have the bright orange discharge coming from this ear too. Somebody's been messing with your ears for sure. Right, so let me just withdraw that. Take a look at your nose. Right. Just relax. I'm just going to push upon your nose, my lovely, and insert those. Oh, you've got orange, mucousy jelly discharge coming out of your nose as well. Now I'm getting scared, I have to say. Check this side. Okay, my lovely. Oh. Okay, I've seen enough. Right. So I'm going to swab your ear. Alright. I'm going to swab this side where I could see like there was something else down there. Alright. Okay, keep nice and still for me. Pop up your hand if it's painful. Alright. Okay, my lovely, let's just see what I can get from here. I'm going to do quite a deep swab if I can. I'm going to swab this one as well. Bright orange. Okay. Just make some notes. I'm going to get our psychiatrist to visit you to do some regression. See if we can't find out what happened to you. No, I'm not saying you weren't abducted, and to be honest, by what I'm seeing, it wouldn't be a surprise. It's just that we've never dealt with that before. But I know that regression can bring back some of the events that you can't remember right now. Okay, so I'm going to take a very close look at your skin. Alright, with my light. I want to just check the hands, okay, because they're looking a little bit strange from what I can see. So let me just have a look at these hands. They look kind of scaly. Almost like the skin's peeling away. Okay. Let me check this one. This is not normal. I've never seen this before. Right. I'm going to take some skin samples, okay? Just gently scrape them away. I'll pop them into this sample pot. Okay. This won't hurt, my lovely, it just might tickle, but if it does hurt in any way, if you're very sore underneath this scale, then just tell me. Okay. Right. You alright there? Okay. Right. Let's just take a little bit from this hand. You okay? The monitors are keeping your blood pressure stable. A little bit of medicine going in there, I can see, but it seems to be good. And your heart rate is a little bit elevated, but I would expect that. There we go. Right. Okay. Scrubbing up your little legs. So, how are you feeling? Confused and sore? Okay, I understand. Right. Say that again. What's happening to your voice? It sounds like you've been on helium. Oh, I don't really like that. Okay. Alright, I'm going to have to take some blood from you. We need to get some good analysis done, okay? I'm going to pop this tourniquet around your arm. Let's get that on there. Okay. Let's get my syringe prep there. Okay. Your veins look really, really prominent as well, which is concerning me. You know when you've done like a lot of heavy lifting or hot exercise and you're all pumped up, they look like that, but they shouldn't be like that, given that you're just resting. Right, okay, so I'm just going to pop this needle in, my lovely, very quickly and just take some blood, alright? Sharp scratch coming now, okay? There we go. Well done. No, this can't be happening. This just can't be happening. Take that off. Just press that in there for a second. I don't want to believe what I'm seeing. Your blood is white. It's white. White blood. Green tongue, orange gloop in ears and nose. This isn't looking good at all at the moment. Right, let me get this off to the laboratory quickly with those samples. Say a few words again for me. That voice. I'm going to check your hearing, my lovely, just to see if anything's been affected. Did you have perfectly good hearing before your abduction? Right, okay. So, just close your eyes for me a second. Just tell me which side you hear my fingers rustling with the gloves, okay? Okay, and again. Okay, and now. Okay. Okay. I'm just going to very gently try and check your sense of touch, okay? If you can feel pinprick sensations from this device here. Alright. If it's too sore, please tell me, but I need to check whether you have neurologically been affected. Okay, whether everything is numb or sensation feels worse than it should do. Okay. Alright. I'm going to start with your face. Alright, so I'm just going to gently run this down your face there. You could feel that. Okay. And on this side. Okay, so it feel the same on both sides. Okay. I'm going to do it under your chin. Alright. You could feel that. Okay. I'm just going to run it down your arms and your hands and fingers. Okay. Yeah. And down your fingers, alright. Is that hurting you? Right, okay. So those two fingers are painful, alright. Just try your thumb. Right. Let me just try this side. So just gently down your arm. Right. Fingers. Oh, painful? Okay. Sorry. Okay. Just try this across your chest. across your abdomen. Okay, just relax there. Okay. I know they said this was painful, but I just need to have a look in your eyes again, my lovely. Alright? Nearly done now. Okay. We'll try and work out what's going on. So could you just look up for me? Okay? Keep looking up for me. Up, 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 up. Okay. Could you just look to your right for me? Okay. You see your eyes are feeling sore? Okay. You feel dry? Okay. Right. Let me just find something to pop in your eyes, my lovely. I know I've got something here. Okay. There we go. They're just some artificial tears. Your voice is sounding so strange. It really does sound like you've been on the helium, and that's changed since I first started the examination. I've never seen or heard anything like this at all. Right, just going to pop a couple of drops in each eye, my lovely. Okay, get some tissue to catch the drips. Alright then, okay, coming in now. Couple there. Right, so I'm going to get that psychiatrist to check you over, and we'll be checking more observations very shortly. But I've done all I can do for now. I'm going to get those tests sent to the laboratory. Okay, the blood test sent. Oh, your eyes are turning black. Oh, okay. Right, okay. I'm out of here. I need to get the professor to come and see you. Okay, alright. Just relax there, but your eyes have gone completely black. Okay, my lovely, just stay. Okay, bye. I'm gone.